About 80% of adults experience low back pain at some point in their lifetimes, and the reason why could focus on one thing. And here to explain that is Dr. Paula Walker-King. Nice to have you here.
Great to be here, Cheryl.
So what are we talking about when we say lower back pain? What is one issue?
One cause is a herniated disc.
Okay.
So it happens quite frequently when people do repetitive, strenuous lifting, improper lifting, smoking puts people at increased risk for this condition. And literally what happens is, this is the anatomical model of what the vertebrae should look like.
Okay.
Literally but in between each vertebra of the spine, you've got an intervertebral disc. What happens in a herniated disc, the intervertebral disc becomes compressed and starts to bulge outward. Now the yellow structures here represent spinal nerves.
Okay.
So when the intervertebral disc bulges outward or herniates, it comes in contact with the spinal nerves, and it can precipitate weakness of one or both of the legs, numbness and tingling of one or both of the legs, and low back pain.
So what causes this?
What causes this? Literally, again, anyone that's engaging in a lot of heavy lifting or improper lifting, advancing age, osteoporosis, degenerative disease of the spine can actually precipitate herniated disc, as well as obesity, because this part of the spine, the lumbar region, actually is the weight-bearing portion of the spine. And so when a person is carrying more weight on their frame, it puts extra weight on these particular
And one
vertebrae.
of the things I saw on the thing, smoking, which
so smoking leaches minerals like calcium, you know, and phosphorus from the skeletal system, and the vertebrae are not spared.
Okay.
And so it makes the vertebrae more brittle and more subject to degenerative changes.
Okay, so what's the treatment for this?
Well, the treatments fall into non-surgical and surgical categories.
Okay.
But most of the time, the symptoms can be managed with non-surgical measures, like resting, you know, proper resting, over-the-counter medicines, like non-steroidal anti-inflammatory drugs. Sometimes a physician may have to prescribe muscle relaxants. It depends. Some people benefit from cold compresses to the area, not held to the area more than 20 minutes, and physical therapy. In worst case scenarios, if these symptoms don't subside, then surgery is usually the option.
Okay, and one final quick question. Once this happens, will it ever go back to its normal state?
Typically not. Well, it typically not without surgical intervention.
Without the surgery.
Yeah.
Okay.
Yeah.
All right. Thank you so much, Dr. Paula Walker-King, talking about herniated discs. So if you have problems with your back, go see your doctor.
That's right. Go see your doctor.
First measure.
First measure.
All right. Let's go to Elizabeth.